Hello, everybody. My name's Mike. I'm an associate professor here at Nickham Health Research Institute and as part of Western Sydney University. And I'm delighted to talk to you a little bit about complementary and integrative medicine treatments for endometriosis. Obviously a little disclaimer from Quendo. So I am just giving general advice. I'm not a medical doctor. I have a PhD, you will obviously find that endometriosis care is quite individualized. So what I'm talking about here is mostly around research based. So hopefully you get some useful information out of it, but unfortunately not everything works for everybody, and you'll need to chat to your doctor or your practitioner about what they think is right for you. It's a bit weird introducing myself, but so I'm an associate professor here in reproductive health, and I'm also the director of research. My background is I actually did a biomedical degree in New Zealand many years ago, and then after that I studied acupuncture and traditional Chinese medicine. So I'm qualified as an acupuncturist and a Chinese herbalist. And then I did my PhD in dysmenorrhea, so period pain, here at Western Sydney University. And since then, I think I've focused a lot on endometriosis and chronic or persistent pelvic pain, but lots of different areas of menstrual health. If I have any expertise, which maybe I hope I do have some, it's in complex clinical trials. And so we're going to talk a little bit about that today. And you can read the rest of the blurb. It's mostly just weird kind of academic titles. So what I think we might want to talk about first, just very briefly, is what is complementary and integrative medicine? Because that's a really hard thing to tie down a little bit, and you might wonder why I'm talking about some things and not others. So complementary medicine is generally thought of as treatments or remedies which are outside the mainstream medical system of that country. So what that means is in Australia, something like acupuncture is complementary medicine, but if you're in China, it wouldn't be, because it's delivered as part of their kind of primary healthcare system. And what is integrative medicine? So that's more where you're combining these kind of therapies with a more kind of Western or biomedical model. So often an integrative medicine GP will not only suggest traditional kind of pharmaceuticals, but also things like yoga and herbal medicine and supplements and things like that. So we often think of complementary, we'll just call them complementary therapies from now on. So we tend to think of complementary therapies as things that someone does to you. So unless you're an acupuncturist yourself, you're probably not doing acupuncture on yourself. So that's a complementary therapy. You go to a practitioner and they will treat you. Complementary remedies tend to be stuff that you can take. And that's often things that you can purchase over the counter at like a chemist or a health food store, or it might be something that's prescribed to you by a naturopath or a Chinese herbal medicine practitioner. So some things that you'll be able to kind of just get yourself, and other things which are you'll need to see a therapist or a health practitioner. So complementary and integrative medicine and therapies really encompasses a huge range of things, and some of the stuff I'm going to talk about today is more common. And just going to say, yoga is an interesting one because it kind of still fits under the complementary and integrative medicine paradigm, but often now GPs who wouldn't consider themselves integrative medicine GPs might suggest something like yoga. So I haven't put it on this slide, but I will mention it briefly as we go along. So as I said, I'm an academic, I'm a researcher, so most of the things I'm going to recommend today is based on the research, and we're just going to talk about what that means. And so firstly, probably really important to say that absence of evidence does not mean evidence of absence. So what does that actually mean? So for a lot of complementary therapies, they're already being used in the community. So for example, when you're developing a pharmaceutical drug, you will generally start off with some kind of chemical modeling, where you'll look for molecules that might be useful. And then you will identify those. And now there's very fancy computer programs to do that. And then traditionally, you'd often then try these, you'd use an animal model to see how they might work. And then you'd go into healthy humans. And then you'd move through, all of these different clinical trial stages. And then if you found that the treatment worked, it would be kind of authorized and then released on the market. So, when you go and take a medication from, that's been prescribed by your GP, it's normally had to go through all of those steps. So that's what we call a kind of a bottom-up approach. In complementary therapies, it's more of a top-down approach. So we know, like, things are already being used in the community, whether it's things like, curcumin or turmeric supplements, acupuncture, meditation. And so we're working backwards. We're saying, okay, we know that people are using it. Can we work backwards to see, does it work? How might it work? And how do we need to tailor those treatments, to work most effectively? And so when I talk today about the evidence, just because we don't have evidence for something doesn't necessarily mean it doesn't work, but it does mean it hasn't been tested, so we don't know. In a few cases, we've had studies where it shows clearly a certain treatment doesn't work, but for most complementary medicines and therapies, really the research hasn't been done, and this is something that we're obviously working on. So let's jump in. What has got the best evidence for endometriosis? And that is by far acupuncture. So acupuncture is the insertion of small, solid needles, very thin needles, into certain parts of the body designed to elicit a particular treatment response. It can be delivered in a whole bunch of different ways. So often it's been delivered through what we call the traditional Chinese medicine framework. So this is probably the most common kind of acupuncture you might get, but it can be delivered through biomedical. So, your physio or GP might give you acupuncture, which is based on a different kind of underlying theory. But most of the research looks at this from what we call a traditional Chinese medicine point of view, where there's particular kind of diagnosis and point choices that underlie this. And if you go and see someone in the community, it's most likely this is the kind of acupuncture that they will practice. So we know that traditional Chinese medicine acupuncture, there's been a number of studies, including a very large trial that's come out of China, which was published in a journal called Fertility and Sterility. And that trial is probably the highest quality trial we have so far and the largest. And they found that using what we call real acupuncture, so acupuncture at points that we expect to cause an improvement for endometriosis, was superior to what we call non-specific acupuncture. This is where they stuck needles in places where there's not an acupuncture point, or there's acupuncture points which are unrelated to this. And they found that this true acupuncture delivered a greater pain reduction. And we found similar results in our pilot study that I published a couple of years ago. And there's quite a few studies going back, probably almost maybe 18 years now, where there's been these positive results seen. So what do we know about this? Well, we know that acupuncture definitely seems to reduce pelvic pain and improve quality of life while you're having it. So for example, you might have a 3-month course of acupuncture, and the research shows between the time you start the acupuncture and the time you finish the acupuncture, your pelvic pain and your period pain as well is likely to decrease. And the quality of life, so how you feel about life, how, the burden of your symptoms seems to improve. The only issue we have is we don't know how long that effect lasts when you stop the treatment. So if you stop the treatment after 3 months, we don't know if it might only last a few weeks after that. It might last several months. There's only one study that looks at this, and they didn't follow up for very long. So that's an area that we still really don't know about. But what we do know is that treatments need to be at least once a week. But most of the research has looked at a twice-a-week treatment. That can be really challenging for women in places like Australia and New Zealand, because acupuncture can be quite expensive. You're often, you might be looking at, $80, $90, $100 for a treatment. And it can often be challenging, we know, for people to find time to fit it in, especially if you have a family or lots of work commitments. So something is better than nothing. Once a week is still likely to provide some benefit, but it's probably better to have it twice a week if you can. And most of the studies have looked at treatments for at least a couple of months. So the shortest that I'm aware of was about 10 weeks, but most are 2 to 3 months. So you really need to think about this as being a longer term treatment. It's not an instant painkiller. For endometriosis. So it's not like, you would go and have your acupuncture and immediately feel much better. So usually it's a cumulative thing. Although some people will say, yes, I feel much better after the first session, that's great. But our research has shown that it often takes about a month for, significant pain reductions to happen. So don't be disappointed or concerned if you're not getting any pain reduction immediately. But I would say from my experience and in my opinion, if you're not getting any changes after about 2 months of regular treatment, maybe acupuncture is not right for you. So talk to your practitioner. But certainly I would expect, by 3 months, you should have a noticeable reduction. You might need longer treatment for the reduction to continue, and that's something that you need to talk to your practitioner about. And when you're looking for an acupuncturist in Australia, especially, look for someone who's AHPRA registered. So that means that they have done all of the correct training, and it's they are likely to uphold, the safety standards that you need. Even though acupuncture has a very mild side effect profile, it's still really important to go to someone who knows what they're doing. Just because something's natural or, kind of complementary doesn't mean that that can't have side effects. Now, in terms of herbal medicine, this can be anything from Chinese herbal medicine to Western herbal medicine. At the moment, really, we just don't have very many good quality studies on herbal medicine. There's some that have come out of China and some other places, but a lot of the time they're not really up to the standard that we would hope. And so at this stage, I'd say it's really hard to know if it'd be beneficial or not, and we can't give a blanket recommendation. If this is something that you want to try, again, it's really important to talk to a qualified practitioner about this. And so someone who has AHPRA registration for, say, a Chinese medicine practitioner is likely to be able to prescribe you Chinese herbal medicine. Naturopaths will be able to prescribe various types of herbal medicine, but it's mostly important just to go to someone who has that experience and qualification. So for Chinese herbal medicine, again, look for AHPRA registration. For naturopaths, they're not AHPRA registered at this stage, so look for them being part of a professional body who regulates naturopaths. And obviously, hopefully someone who treats a lot of endometriosis or similar kind of conditions. So, and they will be able to provide this kind of individualized support. So there is 2 supplements that we know where there is some research to support these. Now, there is another supplement, which is melatonin, which does have some evidence to show that it reduces endometriosis symptoms. Melatonin is interesting because it's actually not available. You have to have it prescribed by a doctor in Australia, whereas it's over the counter in many other countries. So that's why I haven't covered it here. It's because it's something that actually, interestingly, doesn't really fall within complementary therapies, but it's something that you could talk to your GP about because you would require them to prescribe it. But there's a couple that you can buy over the counter from a health food store or a chemist. And I feel quite comfortable talking about these because we know that the side effect profile is really, really low. These are very safe medications, and they also seem unlikely to interact with the current medication you might be taking. But the important thing is that always, whenever you're taking a supplement, even if it's natural or a small dose, always make sure you let your doctor know, just in case it interacts with something else you're taking, because many people with endometriosis are taking, quite a large number of different medications. So always better to be safe than sorry. Always talk to your doctor about this. So what are the 2? PEA, and I never can say this correctly, but it's palmitoylethanolamide. So apologies for the pronunciation. This works on endocannabinoid receptors in your body. So these are natural pain-killing receptors. And these are the same receptors that respond to things like medicinal cannabis when you take it. And so I often think of PEA as a slightly, I guess, weaker version of medicinal cannabis. And it's often combined with some other compounds. The most common one that I'm aware of is polydatin. And so there's a bunch of different PEA products. The evidence is not bad. I think in terms of pain, and it seems to work quite well just for what we would consider general chronic pain. So it's not specific for endometriosis or pelvic pain. So if you have additional pain, say for example, you have fibromyalgia or some kind of chronic pain in other parts of the body, you might find this helps as well. And the dosage is really varied. So it's anything from about 400 milligrams up to 1200 milligrams a day. And there is some forms where they talk about this being micronized, so basically turn into very, very small caps, little beads, I guess, and some of those are then altered in different ways for increased absorption. So you might find those are better absorbed, but there's not really a lot of head-to-head research where it's being compared directly. So it's certainly worth looking into. Very, very safe in terms of side effects, sometimes some gastrointestinal upsets, but those are really, really common in kind of all supplements. So I would suggest, starting with a lower dose and you can slowly make your way up. It can, again, like acupuncture and other things, it's not necessarily an instant painkiller. So this is something you might want to, you might be needing to take for several weeks before you notice a difference. And the other one is NAC or N-Acetyl Cysteine. So we have two small studies. They're both from the same group and they both don't have a placebo control. So that's why I'm a little bit, I think it might be beneficial, but I certainly wouldn't be, I'm still a little bit skeptical because we don't know. And without a placebo group, it's really hard to tell exactly how much NAC itself does. But it tends to be very inexpensive. And as far as I'm aware, no side effects have been reported in either of those studies. So quite safe. And you can take 600 milligrams 3 times a day. And in these studies, they always took it for 3 consecutive days every week. So Monday, Tuesday, Wednesday, for example. And then rest of the week didn't take anything and started again. And they found that even with this kind of intermittent dosing, there was quite significantly reduced pelvic pain and period pain, as well as pain during or after intercourse, so dyspareunia. So again, definitely worth considering. And I would consider these as additions into your toolkit. So if you've already taken some medications and you find, yeah, look, I feel better, but it's not really, I'm still got symptoms which I'm struggling with. This is something you could definitely consider adding as part of your toolkit. One of the things I haven't talked about is medicinal cannabis, because that's really still something that you need to be prescribed by a doctor. And we're still really working out the evidence for this at the moment. But again, perhaps something to talk to your GP about if you're struggling with, pain, gastrointestinal symptoms like bloating, or sleeping due to pain. Definitely have a talk to them about medicinal cannabis. So that's my time up for today. So thank you very much for listening to me. I hope it was beneficial for you. And yeah.